everyone, this is Tosha and we are back, and this week's issue is on sinusitis. And this is really crucial for me as people have regularly pointed out that I may be having sinusitis myself. So to answer all my queries about sinusitis, I have Dr. Arjun Dasgupta, who is a renowned ENT specialist in Kolkata. So I welcome Dr. Dasgupta.
Okay.
Yeah. So, doctor, my first question to you would be, what exactly is sinusitis and where exactly it is located in our body?
Okay. Sinus is sinus. It's located in our skull, in our head, and itis means infection. So appendicitis, sinusitis is infection of the sinus. So why the sinuses are there? To be honest, nobody knows. It's a holes in our skull. There's two in here, two in there, two on the side of the nose, and two in the back of the eyes. And people say that usually they are there because the whole skull bone otherwise would have been too heavy to carry it on our shoulders. Also, it gives some resonance to the voices as well. The main thing, they are lined by the same lining of the nose, and they communicate with the nose. So they produce mucus, and the mucus comes into the nose and it drains off. So that's one of the jobs of the sinuses.
Okay. So there's another query that I have. How common is it that you find people coming in for sinusitis?
It's extremely common. Not a lot of people may take help, go to the doctor. They may try home remedies. They may try home remedies for a long time. And usually there is a reluctance and people don't really understand how much a suffering a sinusitis can bring. So there is a kind of people neglect it for a long time. They think it's nothing, other people have much more serious medical issues. I won't bother them. So they try home remedies and go on for a long time. Especially during the winter months and change of season during the rainy seasons, it's very common.
Okay. So, what are the signs and symptoms that you find in a patient who's coming in for sinusitis?
These three cardinal symptoms. That one, there will be some amount of blocked nose, there will be some amount of sneezing, and there will be some amount of runny nose. And along with that, there may be associated head heaviness, or if things get really complicated, then we get a headache. So these are the main. There may be multiple associated signs like loss of smell, other problems as well. But these are the three main symptoms of sinusitis.
Right. So these symptoms, as you pointed out, the heaviness of the head and the headache needs to be segregated to understand the complexity.
Absolutely. It's very common to have a migraine. A lot of migraine patients comes and tells us that they have sinusitis, but we find they don't have. A lot of sinusitis patients think they have migraine while they have sinusitis. So it's very important to take it into difference. The sinusitis is more heaviness, and migraine is headache. So that's the difference between them. So you need to ask that.
So how do you really diagnose the presence of sinusitis? What is the procedure of diagnosis?
The patient comes to us, and the patient usually knows, to be honest. You don't need a doctor. The patient knows that this is due to the nose. They get a cold, and this cold gets worse, and they start getting really worse, and they start getting headache and heaviness. So they know that this is due to sinusitis when they come to us. It's really that they have some diagnostic dilemmas. So we need to ask them questions whether you have nasal symptoms, and then we have to look into the nose like we do, and then we have small cameras that we can put in the nose and have a very good look to see whether there is something else going on. And sometimes we do a CT scan to find out, and that's an absolute diagnostic test.
Okay. So I've also heard, this is pretty scary. Are sinusitis surgeries really needed or really required? I'm pretty scared of it.
I tell a story. I tell this story to everybody. Our moms and dads had 11 or 12 sons. Okay. Moms and dads, our grandfathers had 11 or 12 sons and daughters. And he used to always listen to the grandma, and they used to say that the younger one is the suffering lot. Now, what exactly are they suffering from? It's from sinusitis, from tonsillitis. They suffer a lot. They are a little bit of having problem all their life, and they grew up like that. And that's how their life was, and nobody bothered in those days. But now we have one or two children. We want them to be perfect specimens, so we can't tolerate them having sinusitis all their life. So we want to give them. See, in 21st century, 2017, we have gone leaps and bounds in medicine and surgery for treatment of sinusitis. So why not? Let's give it.
Right. But there have to be some measures that people can really take at their homes so that they can relieve themselves of the pain or the heaviness, as you pointed out,
Absolutely.
caused by sinus pain.
I mean, there are a lot of grandmother's remedies and they work very well. The commonest of them is the steam. And people take a steam. Steam really works well. There is an Ayurveda preparation called jalneti. Jalneti is usually you sniff up saline water, salt water through the nose. Trust me, it works fantastic. You can do that. You boil up 1 liter of water, cool it down, add a teaspoonful of salt in it, and either you sniff it up, or if you can't sniff it up, get a syringe, medicine, injection syringe. Of course, throw in a little. Pull up the nose and just push it to the nose. And it works better than a lot of other medication, trust me. And because it's not a medication, you can use it as many times till your nose unclogs and its mucus starts flowing and you get relief of your headache.
Right. But there are other non-prescription drugs available in the market which are really doing the rounds, like sprays and stuff like that.
Yes, that's the problem. These drops are fantastic if used judiciously. They are all different variants of nasal congestants, but the most important thing I want to tell everybody is they should not be used for more than 7 days. If you use it for more 7 days, then you get hooked to it, and they have a phenomenon what we call as rhinitis medicamentosa or rebound phenomenon. Basically, what it does, the nose drops. You have a blocked nose. You use the nose drop opens it up, and then nose drop itself blocks it up again. And it's very difficult to find out how much is due to the sinusitis, how much it is due to the drop itself. And sometimes it's very difficult to take them off the drugs. I ask a very simple question that how many bottles do you have? So they say I have 1 at home, 2 at home, 1 in my bathroom, 1 in my car, 1 in my office. I know what the guy has a huge problem. Or I ask them how many bottles have you bought this month. If they say 3 to 4, then you have a problem. If you say 1, may not be a problem. So that's how we quantify.
Okay. So that's all my queries answered.
Oh,
thank you, doctor, for being here. Here's a little token of appreciation from Tio. And
Thank you. Thank you.
And it has been a lovely experience having Dr. Dasgupta over here, and thank you all for watching. And please go ahead and follow Tio on Facebook, Twitter, YouTube, Instagram, and LinkedIn. And keep watching us for more information on health related topics. Bye bye.
Bye.